Anybody out there heard of TMS or Transcranial Magnetic Stimulation? Probably not. I got involved in that in 2018 in St. Louis for treating chronic depression, people that had failed medications. First patient that I worked with was 19 years old. He'd literally almost taken every antidepressant on the market. And using a NeuroStar device, we treated him for 36 treatments over 6 weeks. And he hopped out of the office on his graduation date on no medications. At 19 years of age, he's had a very rough several years. So TMS, transcranial magnetic stimulation, FDA approved for chronic depression treatment in 2008. So it's not new. I mean, it's been around 15 years. And when I talk to physicians, primary care, OB/GYN doctors, 90% of them have never heard of it. Patients typically have not heard of it. And you're not going to hear about it because it's not a medication. This is a non-medication treatment for chronic depression, FDA approved for major depressive disorder, as well as OCD and smoking cessation. And we'll talk about some other things that it's used for and being studied for. One of those is during pregnancy. So I went and saw one of my collaborative physicians who is an obstetrician gynecologist, presenting this information to her, and she didn't even know what I was talking about. I had to educate her a little bit. She's in a fairly big group, so they could probably use having a TMS machine and share in their office. Postpartum depression is a thing. I mean, I asked her, I said, what do you do for postpartum depression? She said, well, I use the SSRIs like Prozac, and I use progesterone. And I said, well, same thing that I was taught, and sort of figured out the progesterone thing on my own, but it's not really that helpful, especially the SSRIs. So this is FDA approved and it can be used during pregnancy. So there was a woman in St. Louis who started her therapy in her 3rd trimester, went into the hospital, had her baby, and on the day of discharge, she stopped by the St. Louis office to continue her treatment for her depression, to continue to complete her 36 treatments. The return rate is about 5% at 2 years. So we've been doing this long enough that there's not that many people that come back and think they need treated again. And the other good thing is it's covered by Medicare and Medicaid and most major insurers. So let me show you our 3rd office. We started in Chesterfield, Missouri in 2018, added a 2nd office, and have now added a 3rd office at the Lake of the Ozarks. So this is the website for Palmier TMS and behavioral health. The medical director is a psychiatrist. I'm the clinical director at Lake of the Ozarks, and we also have a physician who works out of that office. So mental health wellness centers without medication, here's the phone number. That'll get you to St. Louis. I'm not saying everybody needs to come to St. Louis or the Lake of the Ozarks. Here's the locations. But ask around. They're not all over the country, but there's quite a few TMS therapy centers. So here are the major insurance plans. TRICARE, Humana, we can go through all this if you want, or you can go to the website, Palmier TMS. Okay, supporting patients with major depressive disorder, obsessive compulsive disorder, post-concussion syndrome. So FDA approved for smoking cessation, post-concussion syndrome. So think about you're in a car wreck and you have a head injury. This is like a 2-week treatment for post-concussion syndrome. Yale University is looking at TMS after strokes, where people have hemiparesis, so they have difficulty moving extremities, and they're seeing some positive results with TMS, no medications, to improve motion in addition to physical therapy and all the T's that are involved in stroke therapy conditions here, and then mood disorder, anxiety. Now, these are not FDA approved, they're off label, but they've been reported to be helpful. So mood disorder, anxiety, postpartum depression, autism spectrum disorder, and bipolar disorder. 70 to 75% effective without medications for major depressive disorder, major depression. And when I put up the job description for the tech at the Lake of the Ozarks office, a person called me out and said, well, you're saying that TMS for autism spectrum disorder is FDA approved, that's illegal. And I said, I didn't say that. Actually, I let other people pick on this person. And someone put up the article I was going to put up for her to read, dating back to 2010, TMS being used in several centers for autism spectrum disorder. Is it FDA approved? No. Is there data? Yes. Okay, there's the major plans. Medicare, Cigna. I can't get this to do what I want. For some reason, it's not scrolling. Here's some things. Customer satisfaction deals. So if you have not explored this, just type in TMS for depression. And if you can remember transcranial magnetic stimulation, but if you type in TMS for depression in whichever search engine you like, you should find information on TMS. So for you Missourians, relocations with Palmyra, St. Louis, the Chesterfield Valley, Richmond Heights, and now Osage Beach at the Lake of the Ozarks. Hope that gets you all stimulated to look into TMS if you have had major depression and just getting sick and tired of the side effects of medications. You're not going to hear about this by Big Pharma because they hate it. So no side effects, covered by insurance. What a deal. Have a great rest of your day. I'll talk to you later. Bye.